You're listening to the Confident Choice Podcast with me, Dr. Roberto Garcia, a double-board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. Welcome, everybody, to episode 6 of the Confident Choice. I'm your host, Dr. Roberto Garcia from sunny Ponte Vedra. Weather's finally beginning to change. And hopefully we're done with those cold days. And for those of you that are still up in upstate New York listening to our podcast, I'm sorry. It's probably going to be cold for a little bit longer. The groundhog told us that. All right, so we know we always believe what the groundhog says at some point in February. But today, a couple things we're going to talk about. The question that patients often have before they're ever considering surgery is, are they a good candidate for surgery? Will I go to a consultation and will a surgeon say I am a good or a bad candidate? And you know what surgeons are generally looking for is whether a patient is suitable for surgery. And what I mean by that is, there's the suitability from a perspective of a surgeon really comes down to, is the patient going to have a good result? Well, let me backstep. Is the patient going to have a result that they are seeking? And can I, the surgeon, deliver that result? And is the patient going to be happy with that result? And so that's where I kind of defined today's episode as, what is the surgeon looking at and what is the patient looking at? And so we define what a good surgical candidate is on multi tiers. Okay. Obviously, and we've talked about this in past episodes, we've talked about the consultation process and what we are looking for during and throughout the consultation, and not only are we delivering some professional advice based upon photo documentation, seeing things in a photo, seeing things in person, and I can speak to that particularly on the heels of COVID, where we did so many consultations virtually that it was such what I feel was a handicap to me, trying to really give a proper assessment to a patient through a computer screen. And there's so much that we do that's dependent upon a three-dimensional impression of a face, right? It's not like I can just look at a two-dimensional image in a picture or on camera and render a three-dimensional solution. It's very, very challenging. And what I found myself, what I found happening was when I went to finally meet these patients who I had virtually consulted with them, things were different. I was seeing different things that I had not seen in the photograph or in the consultation. And the shadowing was different. The three-dimensionality of the aging process was different. So I found myself, okay, now I'm kind of torn, because now I've told this patient that they needed one or two things. Now in reality, they need something different or additional procedures. And so that's one component of finding out whether a patient's a good candidate. And of course, from the standpoint of the realistic expectations that we are really seeking, and we touched on what defines a realistic expectation. It's that the surgeon is able to visualize and predict an outcome based upon the patient's concerns. And if the patient has a concern that the physician does not see, that physician cannot correct it. And if the physician sees something that the patient doesn't see, then I believe, at least our philosophy here at Contoura, is that we're not going to push something that the patient doesn't see and it doesn't bother them, right? And oftentimes I will get asked, hey, well, what do you think? And tell me, give me a total overview. And usually what I'll say is, all right, well, let's just first talk about the things that bother you. we address those. And so you put those on kind of a ranking list. And so I remember my mentor used to use the totem pole concept. And I never knew the idea that, things were ranked on the totem pole based upon order of importance, like the God would be at the front and then the eagle or whatever it was. For you Native American patients, I apologize that I might be simplifying something that's probably very serious. But the fact is that when we are seeing our patients, we are ranking things in priority. And we always want to rank from what's going to make the biggest impact that's going to subsequently remove the load of these lower ranked things, right? For instance, somebody says, I have 5 different things on my face that I do not care for. Well, what we're going to do is we're going to look at that one big thing, and more than likely, those numbers 4 and 5 are no longer even going to come into play because you've now brought the face back into balance, right? And we talked about that facial harmony and facial balance in last week's episode. And that's kind of that idea that correcting that major thing now all of a sudden has that butterfly effect of correction on those less major things or those minor issues in the aging process. And so we really are trying to find those expectations that we're seeing what you see. And that is a challenge, ladies and gentlemen. And I can tell you that is an art form that's created with years of experience. And when I was young in my career and I was still wet behind my ears, I would tell patients 20 things. And you need this, 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 and this. And you would see a patient looking at you like a deer in headlights. And they'd say, well, I'm a lost cause. I'm leaving. And so that is something that I think as a specialty, we've become more understanding and accepting of the patient driving the information. And so the patient kind of driving the consultation. And that's how it's supposed to be. Now, having said that, there is the other extreme where a patient absolutely drives everything and is very demanding and is telling us, okay, I want you to do this, this, and this. And a lot of surgeons fall for that. And I don't think it's right to the patient that we sacrifice our professional judgment and acumen that has been decades long developing for a patient who might have gained their knowledge on social media or on the internet, and they have they have a smaller bank of information. So I think the onus is on us as the surgeons to have a realistic and appropriate recommendation for our patients that's not only going to appease their concerns and their pain, right? And we talked about that in episode 1, but is also going to render an acceptable long-term natural result. And so we are really striving for that communication between the patient and the physician, that we come together in the middle and everybody is happy with the plan. Now, that's not to say that I'll oftentimes in reviewing patients' photographs that I'll see something, we book out several months in advance, that I'll see something, a month later while I'm reviewing the chart, and I'll say, wait a minute, I didn't talk to this person about this, and they kind of mentioned it. So I always have to tread lightly, and I'll come back, I'll have them come back in and say, listen, I'm not being pushy, but I did see something else that I think would make a difference. And you have to understand that I believe that there are 2 types of surgeons, or I think there's surgeons that are, particularly in our industry, there are surgeons that are financially driven, and I think there's surgeons that are morally driven. And the way I was raised and the way I've trained other surgeons is that if you don't have a moral compass in treating your patients, and you don't have that thought in the back of your mind of, I'm looking at this person like it's my mother or it's my sister or my father, then you have lost the true appropriate, suitable direction of how that relationship should be established. Because patients are coming to us almost asking, I need your help. Something is bothering me this egregiously. you are the only person that can help me, and I trust whatever you're about to say. And with that comes a tremendous amount of responsibility from our end. From the timing perspective, we kind of then let me shift over to the patient's concerned. Comes down to what timing is correct. And there's this concern that patients say, I never thought I was going to be doing this. I never thought I would be doing it this soon in my life. And the fact is, aging is so unique to a person. And what one person at the age of 50 looks like compared to even their sister can be so dramatically different. Yes, genetics does play a role, but there's such a huge part of lifestyle. There's such a huge part of just the way your body was designed. And if I can give our audience really important pieces of information with regards to this, is don't get so hung up on the age that you're considering doing something. But what is it that negative impression that you have of yourself, what ill is it causing to you on a daily basis? And if you can cut that out, whether it be in your 40s, 50s, 60s, and onward, then I think it falls upon you to remove that negativity out of you, and so and correct what's truly driving you into that consultation. And so timing really is a very personal thing. And I remember one time, and this was about 8 years ago, I had a girl come to see me. She was 29 years old. 29. She had had 2 procedures already in her face. Scars were awful. She had a big scar here in her neck. She had scars around her ears. And this girl came to me at the age of 29, having had 2 procedures, devastated. And where normally you would say, why am I operating on a 29-year-old person? They're young, they're healthy. And we almost felt compelled to correct the old surgery. So I found myself doing a lift on a 29-year-old girl. And she came out amazing. And she is super happy. I haven't seen her in a few years, which is probably a good thing. But super sweet young lady, and we really changed her life, because this is where I think the mistake happened. She came to see that original surgeon. That original surgeon did not utilize his or her moral compass in saying, perhaps this isn't the right thing for you now. But yet they utilized their financial compass. And as a result of that, that created more of a stigma, a negative stigma in that young girl's mind than she ever had prior to the surgery, right? So now she was scarred, truly not only emotionally scarred, physically scarred. And so there we were literally treating 2 things. We were removing the physical scarring, and we were removing the emotional and social scarring that she had. And that flip that you see in the positive is what I get up every morning for, right? That's what I want to see with every patient. When that flip is the other way, it's devastating. And so the emotional component that we are looking for with our patients is we want to see that you are obviously doing this for the right reasons, that you're doing it for your reasons. But most importantly, that you're going to become emotionally empowered afterwards and for you, not for your job, not for your spouse, not for your friends, or not for the proverbial Facebook competition that everybody lives in nowadays, right? And so the idea that we are helping people really get back to how God made you, right? In loving eyes, that's what we're truly after. So let's shift gears here and talk about what might be the one of the final things that the patient will conclude upon during the consultation, and is really centered around the trust factor that the patient generates for the surgeon. And during the consultation, a lot of patients are really coming to figure out a couple things, all right? So used to be that patients were coming to meet the surgeon and find out about the surgeon for the first time during a consultation, and because there was no information, there was no internet. Everything was word of mouth, and it was, oh yeah, he's a super nice guy, you should go see him. And so they had no idea, probably not even what you look like. But now I have patients, when they come in to see me, they pretty much know everything about me. You know, they've seen all of my results, they know all my awards, my accolades, they've seen all the reviews. They know about this practice just as much as we may know. And what they're trying to find out is, obviously, can they afford the surgery? That's a big one. Will the surgeon take care of me afterwards? And that's where we start building that major component of the consultation question, so to speak, and that's that trust factor, okay? And the trust factor is really two things. Will they take care of me afterwards? And is the surgeon telling me what they're telling me in the consultation? Is it truly for my benefit? Is it truthful? Are they not just saying something to either A, placate me, right? So accept whatever I want, or B, are they saying, hey, listen, this is the best thing for you. If I was in your situation, this is what I would do. And with that, the patient generates that level of trust, or they do not. If they've generated that level of trust, then the patient is more than likely, if they can afford it, are going to move forward with the surgery. Okay, they found the right surgeon. They have the ability to have the surgery. They're both in communion with the idea. They're going to move forward. But the scarier alter situation, which I don't know if it happens as much anymore in my practice, but it probably still does, is that I'll just tell you, I give a patient a solution. The patient doesn't like that solution because it doesn't fit their preconceived idea of what they needed, and they go seek that answer somewhere else. And then they find the surgeon that will do what they want instead of what is right. And I'm sure that happens. And I've seen the results of somebody not accepting my recommendations and somebody wanting more surgery than what I was offering. They go elsewhere. They convinced a surgeon to do it, and then they're coming back for some kind of a revision or correction of what was, inappropriately done. And that then puts you in kind of a bad place, the patient, because you almost feel guilty going back to that surgeon who was honest with you at the front. And I try to never judge anybody, but I try to always treat every individual consultation as if it's a new organic conversation. I don't leave historical conversations in the middle of a current conversation. I don't know if I'm being clear about that, but that's an important thing, because whatever the decision that the patient made, whether it's against what I had recommended, my job at that point is not to chastise them. My job at that point is to see if I can help them. All right, forget about what happened in the past. Let's move forward. All right, let's correct what we have. This is what we have right now. We have to move forward from this. And so I've seen that situation happening, and it used to happen more, but also with patients seeking the financial difference, okay? And so they'll go to a surgeon who is much less expensive, And unfortunately, or they'll go out of country and they'll have a horribly done surgery, and then they'll come back, and here we are trying to correct something. I had this lady one time who went to Cuba, okay, communist Cuba, where they barely have gauzes, okay? They have, by the way, there's no electricity there right now. I don't know if you guys know that. It's dead. The island is completely dead. She had a facelift for $750, right? Look, I felt awful for her. The scars that she had around her ears were horribly debilitating. Not only physically, appearance-wise debilitating, but she was in so much pain with the scars. And so it took me 2 surgeries to move those scars out of the face. So now a financial decision that somebody makes to save some money ends up costing them 3 times the amount in the long term. And 3 years of recovery, maybe? So now you've spent 3 years of your life trying to correct something that if you didn't have the money or the financial means at the beginning, what I tell patients is, wait, save your money. The time will come where you're financially able to do it. But don't let a cheaper solution be what causes a long-term triplicate financial commitment. And so I'm going to close with the idea that just remember, I want you all to remember one thing. The words "not yet," it's okay to hear, okay? If a surgeon tells you "not yet," you're not ready for this yet, believe them, okay? Don't ever question a surgeon who is stepping back in the aggression of your care. That person is being honest with you. And that's the type of person you want in your corner, right? And so my final part, which is my favorite, everybody's smiling every time I talk about this, and I can't stop smiling either. And Tony, you're in the studio today, and you haven't been privy to this. And so Dad, as you all know, I always talk about Dad. Tony, I don't know if your dad died last year. And he died in June. Well, he liked you a lot, actually. Yeah. And it was hard because a lot of the lessons that he gave me throughout the years, my dad was always talking. Maybe this is where I get it from. Dad was always talking, always giving advice, always wanted everybody around him to be better versions of themselves. I used to call him Huckleberry Finn. You remember the story of Huckleberry Finn and the idea that he could convince anybody to paint the fence with him, right? That was Dad. He the next thing you know, you were doing all the work, and he's telling you, all right, now brush it this way and brush it that way. But one of the things that he mentioned, and it came to my mind recently, was ranking your friends. And it always sounded weird when he would tell me this. You don't know anything about this. All right, this is a good one. And so he would say, listen, whenever there's different types of friends in your life. There's friends that you ask, hey, can you do me a favor and mail a letter for me? Okay. There's friends that you say, hey, I killed somebody last night. Will you help me bury the body? Okay. Obviously, that's an extreme. But it's the 1 to 10 kind of scaling, right? And he would talk about you have people that are really, really close to you, and then people that are your friends, but they're acquaintances, that if you ask that acquaintance friend for a really, really serious thing, they're probably going to let you down, right? And they're not going to be able to follow through on what you're asking them to do. And if you ask that really, really serious friend, that person that would die for you, to mail a letter or do something they're probably going to be insulted. Like, really? This is what my friendship to you is about? So it's the idea of stratifying and understanding where your friends are. And that's a hard one because when I was a kid, I thought everybody was a 10. I thought I could count on any friend to do anything, and I spent my youth being let down by people. Right? I'd ask him for something. I mean, man, I cannot believe that this guy that I met at the bar wouldn't do this for me. You know, and so it's as I've gotten older, you realize that there are people that you can ask certain things of, and that you can plan to commit things from, or have them commit to. And there are individuals that you just can't, right? But they're good for other things. And so just because somebody won't, testify in court for you or an alibi for you doesn't mean that they're not a good friend. It just means that your friendship hasn't developed to that level with them yet. Because as time goes, that person who may be a 2-level friend can potentially move up to become a 7 or an 8, right? And that person who is a 10 may let you down or may stray away from you. And the next thing you know, they're a 2 or a 3. You know, how many friends did I have in medical school, college, and residency that I thought at the time were the center of my life? And now I talk to them once a year, text with them, their life is over here, mine's over here. I couldn't call them up right now and say, hey, will you cover for this, or will you do this for me? So I think that youth spend so much time in enumerating friends and saying, oh, I have a big friend group, but that's not really what matters. These kids really have to know that have a certain core of people that are really close to you and that believe in the things that you believe in. And I think I was talking about this a few weeks ago, that surround yourself with people that you want to be like. Always friend up. Have people around you that are better than you in life. So, a little bit of a challenging lesson there, and that's a hard one to swallow. But Dad's lessons weren't always soft and peachy, Tony. They were hard. Made you think. And by the way, this one I questioned whether I was going to talk about, because some people can misconstrue what it is. But I think that it's important that people realize that you have to understand where you are in your relationship with people. And sometimes they let you down, and other times they surprise you. And that's good. Maybe when they surprise you, they move up a notch. Give them a little star, Alyssa. You moved up to level 6. All right, so we're going to close. This has been a good podcast. I'm going to go enjoy the sun today. So we're going to close with our closing statement that Alyssa says I never get right, but good decisions always come from good information. So thank you, ladies and gentlemen. I hope you have a blessed week, and we'll see you next week.